Hi friends, welcome back to our series that we called Infertility, and this time we're going to talk about the many ways of avoiding infertility. So if you did not watch our previous video, we talked about why the rate of male infertility has been increasing and the main disorders that are actually associated with male infertility. So this time around, let's talk about the details of actually one of the root factors that can result in infertility, right? So the main one is unhealthy lifestyle. This is things such as consuming a high-fat diet, and this usually leads to obesity, and in turn, this can have negative impacts on the structure or the shape of your sperm. And this is one of the conditions that we called teratospermia in our previous video, so you can go and check it out. Now, the individuals who have been experiencing teratospermia, they are not the only ones who are affected, because as some articles that we read, it said that they could actually in some cases conceive and give birth, but now because their sperm is abnormal, that can affect their offsprings. So it has negative consequences on their development, which can then affect them later in their lives when they are much older. So now you might be wondering why individuals who have struggles with obesity are highly susceptible to infertility. This is mainly because it was noticed that their hypothalamic pituitary gonadal axis is abnormal, which then results in their estrogen levels to be increased, while at the same time their testosterone levels are decreasing, their luteinizing hormones is decreasing, as well as their follicle stimulating hormones are all at the same time decreasing. And as you might already know, hormones play a very crucial role in literally regulating pretty much all the functionality of everything in our body. And if you do not know, we have a separate series that talks about the different hormones and how the imbalance of those hormones can cause symptoms such as erectile dysfunction. So you could go and check that out as well. So now, it is quite important to also mention that unhealthy lifestyles does not only mean consuming a high-fat diet. This can also mean things like smoking, consuming excessive alcohol, things like consuming drugs, even excess exposure to high temperatures. Those are also considered as unhealthy habits, which each individual should be able to control or at least avoid. But also it's very important to mention that there's other unhealthy lifestyles that are a bit more complicated to control. Things like pollution, for example, radiation, and even aging, because sperm quality, it deteriorates as you age. So in a nutshell, we can conclude that healthy lifestyle is a very crucial contributor to a healthy reproductive system. So please make sure that you stay healthy, and thank you so much for watching. Next episode, we will talk about female infertility. Thank you. Bye.